wabarakatuh. With me, Aina Izzati, Bt.Abd Malek. Today, we want to discuss about sinusitis disease. Sinusitis is known as rhinosinusitis. Rhinos is referred as nose. Sinusitis is referred as disease. So, sinusitis is inflammation of the nasal sinuses commonly caused by bacterial infection, such as common cold. So the cold virus will attack the lining of the sinuses and can cause inflammation. So our body will respond to the virus by producing more mucus. So when the sinus inflame, the mucus is a good place for bacteria to grow. This is called blocked sinuses. It can due to untreated allergy, cold, and cause pain in the face. So what is a sinus? Sinuses is hollow space around nose and eyes. So there are three types of sinus, which are first is acute. Acute is infection can last up to 3 weeks. It can caused by bacterial infection related to respiratory infection, which are common cold or untreated allergies. Second, subacute, when acute infection lasts for 4 or more times in 1 year period. So the last type is chronic. So chronic is 2 or more symptoms appear and last for 4 months and years if not treated due to the allergic, structural problem or immune system. So there are signs and symptoms of sinusitis. So when bad breath, feeling of fullness in air, coughs may be worse at night, pain pressure in forehead, cheeks, nose and between the eyes. So there are early treatment that can be reduced intake of medicine. The first one is steam inhalation. Use bowl of hot water with a towel overhead, help to thin the mucus and drain the mucus. So get plenty of rest. Laying down can make your sinuses more relaxed. So 3 is drink a lot of water and sip hot water to thin the mucus. So that's all. Thank you.
Problem statement. Sinusitis is a common head problem that characterized by the mucosal inflammation of paranasal sinuses. From the start, in edition of 2010 by Dr. Kapanaya, the estimated prevalence of sinusitis in Malaysia is around 12.8%, which means around 3 million of Malaysia are suffering at any one time with at least 30 million of antibiotic prescribed per year. Besides, there are almost 18 million cases are estimated per year. Sinusitis can be categorized into 2 categories, which is acute and also chronic. Hence, the objective in this project is, first, to analyze the severity patterns of sinusitis in Malaysia, 2, to identify the major causes of sinusitis among the Malaysian, and lastly, to determine the most common treatment for sinusitis in Malaysia.
Okay, moving on to the methodology parts of these assignments, there is a way to achieve our objective, which is we ran a survey for 30 respondents, consists of others and not only restricted to UiTM students. This survey was conducted in order to know further about sinusitis disease. Based on our condition and situation right now, which we are in pandemic COVID-19, we choose to conduct this survey online by distributing a Google form which consists of several questions which related to our topic. This is because Google Form is very easy to handle and can be used by anyone freely. Besides that, we also made a personal interview with certain respondents through WhatsApp. Besides doing a Google Form and personal interview through WhatsApp, we were also conducting the survey by doing a video call with our respondents. This is the example of one of our respondents.
Regarding your treatment, does your treatment involve medication? If it does involve medication, what kind of medication do you usually take?
Antihistamine and nasal spray.
I see. Okay, so antihistamines and nasal spray.
In this platform, we also asked the same question from them that related to our topic. The question that we asked during the survey are divided into 3 parts, which are general information, social history, and also treatments. In general parts, we managed to get information about their age, sinus history, causes either they get from dust, season, or food, and we also provide a space for them to fill if the answer that we provided aren't in their list. This is because sometimes people have a different causes or symptoms that we didn't know. So this survey is very, very helpful for us to know further about the sinusitis disease. On the social history part, we got some information about their occupation, lifestyle, either they are smoking or not. This is because, based on our research, smoking can also be one of the causes of getting sinusitis. Besides that, we also asked about their alcohol and additive substance intakes. On the last part is about the treatment which they receive, because some people are aware that they have a severe sinusitis. So they manage to get a treatment such as medication or operation. In this part, we asked further about their medication type, either they took antihistamine pills, nasal sprays, or others. Besides that, the estimation time of taking the treatment also important, which is how many times they took for a month. These information are very helpful for our studies and analysis.
Okay, let's moving on to the next part, which is result. Based on the survey, there are 30 respondents, where 23 of them are female and 7 of them are male, aged between 20 to 53 answered the survey. Most of the respondents aged between 20 to 20 years old, and only 1% that age above than 50 years old. 23 of the respondents stated that they have the sinus history, while the remaining 7 respondents say they does not have the sinus history. The survey also asks whether the respondent know what type of sinus that they have, because there are many types of sinus, such as acute sinus and chronic sinus. So from the survey, 20 of the respondents say that they does not know what type of sinus that they are having, and some of them said that they're sensitive to hama, they have a morning sneezing, high fever, allergic, and one from them said they have acute sinus. There are many causes of sinus, such as season, food, dust, and also cat fur. And from the survey show that dust has the highest rank, where 26 of the respondents say that dust as their cause of sinus, other than season, food, and cat fur. There are many symptoms which show when someone is having a sinus, such as headache, runny nose, cough, fatigue, and so on. And from the survey, the highest symptom shown by the respondent is runny nose, followed by decrease of sense of smell, and also they are having headache. Okay, next question asks how long the symptom will last. And from the survey, there is 26 over 30 respondents stated that the symptom lasts less than a week. Moving on to the question about the respondent family history, because disease can be carried through genetic. So from the results show that the highest family history disease is asthma, and followed by the sinusitis. This survey also asks if the respondent presently smoked or ever smoked in the past, and do they drink alcohol or not. And the best thing is all respondents answered no to these questions. Sinus actually can be treated by taking a treatment, but from the survey showed that 16 respondents does not take any treatment, while 15 of them took medications and 12 of them drink a lot of water. Next,
The highest type of medication used by the respondent is antihistamine, such as loratadine as well as cetirizine, and some of them also use nasal spray and pain reliever as medications. The highest estimated medication used by the respondent is 1 to 2 times in a month only. Okay, the last question from this survey asks, does the sinus causes any inconvenience during carrying out daily activities or not? From the results show that 23 respondents say yes, while the 3 remaining respondents say no. Okay, that's all from my part. Thank you.
Now, time for the discussion. As mentioned before, there are 3 types of sinusitis. Based on the results, majority of the respondents are seen to be infected by a sinus called acute sinusitis. Acute sinusitis is the most mild version of sinus. This is because the symptoms of the sinus, such as decreasing smell, allergies, and runny nose, are seen to last about a month or so before the sinus gets better. Moreover, the respondents who are seen to be infected by severe sinusitis are mostly ages from 25 and above. This is because as we grow older, our nose lining gets thinner, which makes us more prone to be infected by the sinus. Furthermore, the main causes of sinus among respondents are mostly dust and cold weather, but there are very few who are infected by sinus due to food that they consume. It can also be said that the treatments that are involved are usually or commonly nasal sprays and antibiotics. Regarding this survey, questions such as smoking, alcohol intake, and drug usage are asked because all these matters can contribute to a person being infected by sinusitis. Smoking can contribute to a person having sinusitis because when smoking, the airway of the nose will irritate, and this causes gases such as ammonia and formaldehyde to be released. These gases will cause an increased amount of mucus to be secreted. Meanwhile, alcohol can cause the nasal cavities of a person to become dehydrated and swell. Drugs and addictive substances can contribute to a person having sinus because it can cause the mucous membrane to damage. When the mucous membrane damages, the nose is unable to humidify air, which will lead to possible infection of sinusitis. Therefore, one should always remember to take good care of their health by preventing themselves from doing any matter that could lead in getting a disease or an infection such as sinusitis. One of the ways to prevent sinusitis is by drinking a lot of water and also avoiding any dry environments. That is all for the discussion. Thank you.
In conclusion, based on our project and our survey, we noticed that the person that commonly faced by the sinusitis is in the range age of 25 and above. And the common type of sinusitis that has been faced by them is the acute sinusitis. The main causes of the sinusitis are dust and also cold weather. But sometimes they also get the sinusitis from eating food like seafood. The most common symptoms that has been faced by them are like runny nose, decrease in smells, and also allergy. Lastly, the most common treatment that has been taken by them are by using the nasal spray and also the antibiotics. There is a summary of what we are getting from our survey and also our discussion. Thank you.